The American Cancer Society has new recommendations for cervical cancer screenings, but those new guidelines are a cause for concern from doctors.
Yeah, they say especially right now at a time when a lot more women are already delaying their preventative health care screenings because of the pandemic. Jesse Schultz looked into this. Jesse, you talked with a doctor. What did they tell you about this?
Well, the worry is that less women will come in and out of the hospital for comprehensive cervical cancer screenings, a cancer that is extremely treatable so long as it is detected early.
I'm worried that insurance companies will make this decision for us. And I'm worried that patients will be confused with the new recommendations and not come in.
The current cervical cancer screening guidelines advise the Pap test for women starting at the age of 21, but the American Cancer Society is now recommending delaying testing altogether until 25, and then sticking with just the HPV test every 5 years after. A Pap test is a closer look at the patient's cervix. An HPV test is collecting a swabs of cells to see if the patient is positive for HPV, because certain strains can cause cervical cancer. Here's the problem. An HPV test alone picks up about 97% of cervical cancers, but adding it in with the Pap test, that increases to detection of 99% of cervical cancers and precancerous cells. A doctor I spoke to here at Metro says the co-testing of both Pap and HPV screenings is what is saving lives. And to try and phase out a Pap test altogether and start testing later in women's lives could be potentially dangerous.
99% versus 97% is great if you're an economist and thinking about healthcare costs. But I'm unwilling to accept that 2% more of my patients will have cervical cancer because of these recommendations. And I think most physicians feel strongly about advocating for each patient and not just healthcare costs.
And I asked women on social media, would you delay getting a comprehensive cervical cancer screening until later? And 85% of them said no, a few of them even telling me that they found cervical cancer and precancerous cells far before the age of 25. Reporting live in Cleveland, Jesse Schultz,